Premier Ford, thank you so much for your time. I'm wondering if I could start with a personal question. A lot of people in this province wondering how you are holding up, how your family is handling this crisis.
Well, I appreciate it, Alan. It's we're well, but I worry about the frontline healthcare workers and the grocery clerk folks that are coming in day after day after day, and they're having sleepless nights. So we're fine. I appreciate that, but my number one concern are the frontline essential service folks that are out there.
Premier, how much personal protective equipment for hospitals and frontline workers do we have left? And has there already been an impact from the United States trying to keep the equipment on their side of the border?
There has been a big impact, Alan, and we're down to about a week's supply, and it's very concerning. That's what we focus on pretty well around the clock. I'm expecting a call from the Deputy Prime Minister shortly. I just got off the phone with Martin over at Woodbridge, and they have their first few thousand coming off, and I'll be able to bring that to my press conference tomorrow. And we're working with the United States. I had a phone call from Ambassador Lighthizer on the weekend, and he's doing everything he can to make sure that we're exempt from the presidential order.
You've talked about Ontario manufacturers retooling. Realistically, how long will it take for those manufacturers to get that equipment to the front lines?
Well, the really good news is Health Canada gave the approval for the N95 masks, so they're going to be ramping up over the next few days. I'll have a couple of the first items in my hands tomorrow, and then they'll just continue ramping up. But we're going through approximately a little more than 500,000 N95 masks. We also have the surgical masks that seem to be a little easier to come by, but not easy, but not as hard as the N95 mask right now. We really need the support of the federal government. It's absolutely critical. I know they're under the gun too. They're trying to deal with all the provinces and the 3 territories, and I'm sure they're under the gun. But we're in desperate need of more PPE items off them.
Premier, we've seen tragedy unfolding in Ontario nursing homes, and families are wondering, should they get their loved ones out? They're wondering if they get sick, if their loved ones get sick, what kind of care will they get? Will they be taken to hospitals? I'm wondering what your message is tonight for those families and those residents.
Well, I have a family member in the same position. My mother-in-law is in long-term care as well, and it's heartbreaking for the families. But if they do get extremely sick, they will be taken to the hospital, but it's absolutely critical. We put that iron ring around long-term care and seniors' homes. I was a little disappointed to hear about the senior home in Niagara that are having a pub night last week, and now we have people infected with this virus. So it's absolutely critical that we keep our seniors safe, and if they get COVID, then they're quarantined into a different area of the long-term care home, and as well as the hospitals. We're quarantining one wing of every hospital out there to make sure that it doesn't spread throughout the system.
Yeah. Further to that, you talked about your disappointment with a pub night. A week ago, you said that you were disappointed at how busy it was outside, how many people were in the parks. I'm wondering what you saw over this past weekend and what your message is.
You know, we saw quite a bit of traffic along the lakeshore, and Alan, I understand people, you know, as I say, they start going a little squirrely inside the house and they just want to get out and go for a walk, and I recommend, if you're going to go for a walk, keep it to your neighborhood. And I understand you have to go out and walk your dog and just get some fresh air. But as one of the doctors told me, along the path, along Lakeshore, it takes one jogger, one walker to sneeze or spit or something. It goes on the ground, someone walks on it, and it carries on the soles of their shoes. So that's another reason we We need to have people stay at home to the best of their abilities, and it's just going to make a huge difference.
I think there's still some confusion about that, Premier, about whether or not people should be going for jogs or walks.
Well, I'd prefer them not to. I really would. I get out there every single day, Alan, and beg, plead people to stay at home. And the vast majority are listening. Like you go out into the suburbs or any other area, it's pretty empty. And even downtown, it's relatively empty, but I guess people still want to go for their jog down on the lakeshore along the path there, and it seemed quite busy. I was shocked to see how many people were down there.
You talked about your disappointment with the American administration when it comes to personal protective equipment. Would you instruct hospital workers and healthcare workers that go across the border, either in Sault Ste. Marie or Windsor, to say, no, you got to stay on our side of the border, don't go over there?
I don't want to go tit for tat back and forth and do that. I'd rather have the cooperation with the U.S. administration. I had I thought it was a very positive conversation with Ambassador Lighthizer over the weekend. He gave me a call, and he understands the situation. He understands why I'm frustrated, and he's working on it. We just want to make sure we get clearance from the Vice President or the President. I had a conversation with Deputy Prime Minister Freeland as well. And she's working her end, I'm working my end to make sure that this doesn't happen. We had 3 million masks stopped at the border this weekend coming up to Canada, and that's just unacceptable. It's absolutely unacceptable that they're doing this, and hopefully we're going to work through it and get an exemption for Canada.
And a final question, Premier. We learned on Friday that the pandemic is likely to run 18 months to 2 years for its full course, and that a large proportion of the population is likely to be infected. I'm wondering if you've thought about ways that people who have had COVID-19 and recovered are then somehow able to go back out and go to work.
Well, we've thought of that, and this is going to be a long haul over the next 18 months and 2 years. We just have to do everything we can in our powers to slow the spread, and everything's on the table, Alan. Depending on the situation we're facing, will determine when people can go back to work, and that's critical. Health is number one. Right behind that is our economy, and we have a team working on the economy when we get through this, because we will get through it. It's just a matter of when and how fast we can get it done. But we have to never lose track that a lot of people have lost their jobs right now, and be it temporarily or full time, because businesses are going out of business and they won't be open. So we're working on a complete plan to help these people get back on their feet.
Premier Doug Ford, thank you so much for your time.
Thank you very much, and continue the great job. Thank you, Alan.